While the world is trying to recover from the effects of the COVID-19 pandemic that struck our world in late 2019 from China, the World Health Organization reports that Ghana records its first outbreak of Marburg virus disease. Marburg virus disease is a highly virulent hemorrhagic fever that is related to the deadly Ebola virus disease. Marburg virus disease has a mortality rate that ranges between 24 to 88%. Already, Ghana has reported 2 fatalities from this case, and about 100 contacts have been put on close monitoring and isolation. The first outbreak of the Marburg virus disease occurred in 1967 simultaneously in Marburg and Frankfurt, Germany, and Belgrade in Serbia. After that, outbreak of this disease has been recorded in Angola, Democratic Republic of Congo, and South Africa. The Egyptian fruit bats and African green monkeys and pigs are said to be the primary carriers of the virus. And once humans contact them, human-to-human transmission is now possible by direct contact with broken skin, mucous membrane, bodily fluids like urine, vaginal fluid, blood, and also contacts of the human broken skin with surfaces that has been contaminated with these bodily fluids. Symptoms of infection with the Marburg virus disease is usually sudden, and they include such symptoms as severe headache, fever, severe malaise, joint pains, and generalized body pains. And by the third day of the onset of symptoms, patients would progress into having nausea, vomiting, abdominal cramps and pain, and usually very severe diarrhea. By the seventh day of the onset of infection, severe hemorrhagic manifestations will have set in by way of seeing blood in vomitors, bleeding from gums, bleeding from the ear, bleeding from the nose, bleeding from the vagina, even bleeding from the anus. And bleeding from intravenous access could prove very, very troublesome also. Following this very closely will be the central nervous system manifestation of confusion, aggression, and irritability. In fatal cases, death usually occur by the 8th to the 9th day of the onset of symptoms, and this usually results from severe diarrhea and dehydration, severe blood loss, and multiple organ failure. It is usually difficult to distinguish clinically from other diseases like malaria, typhoid fever, dysentery from shigellosis, meningitis, or other viral hemorrhagic fever like Lassa fever and Ebola virus disease. So usually, confirmatory diagnosis is by way of laboratory investigations through ELISA, antigen detection tests, serum neutralization tests, reverse transcriptase polymerase chain reaction, and isolation of the virus by way of cell culture. Currently, there is no proven treatment that is available. So treatment or management is usually by supportive care, by way of rehydration, especially with intravenous fluids, and treating of specific symptoms as they arise. However, potential treatment protocols that have been evaluated include immune therapies and giving of blood products. So currently, prevention is the key. Prevention is the key. There should be a high index of suspicion at the community level. Once there is someone in the community at the family level that is presenting with symptoms that are suggestive of malaria or typhoid fever, symptoms like severe body pain, headache, generalized joint pain, vomiting, nausea, diarrhea, we should suspect quickly that it could be one of the viral hemorrhagic fever like Marburg virus disease. So early presentation to the hospital is important. Careful handling of bodily fluids is important. And at the hospital, there should be the early diagnosis using confirmatory tests from the laboratory. And on the part of healthcare workers, the use of personal protective equipment is encouraged. So let us continue to watch out. Let us continue to stay safe. Let us continue to stay healthy. Remember, high index of suspicion is key in preventing the Marburg virus disease from affecting us. Until my next video, I am your doctor and friend on the path of living long and staying healthy. Until then, I say cheers to a healthy life. Stay well, stay alive, stay healthy.